I'm Dr. Bill Walker. I'm Health Director and Health Officer for Contra Costa County, and I am proud to be standing in front of Contra Costa Regional Medical Center. Contra Costa Regional and our health centers, along with other public hospitals, are ground zero for the crisis in health insurance in our county and in our nation. Every day we see more patients coming in who have lost their health insurance for one reason or another, but we know that looking to 2014, health coverage will be guaranteed for all Americans. We're here today to celebrate September 23rd, the 6-month anniversary of the Affordable Care Act, and to hear what will actually happen starting now to ensure that more people will continue to have access to health care and will not be subject to losing it. It's my pleasure to first introduce Congressman George Miller. George was one of 3 committee chairmen in Congress who were instrumental in writing the Affordable Care Act and in getting it passed. George is a resident of Martinez, a native of Richmond, has been battling for issues of health care for many years. He was one of the instrumental folks in finally bringing to fruition an effort that had been tried many times before over the last 100 years by other presidents and Congresses to finally successfully pass the Affordable Care Act. My pleasure to introduce Congressman Miller.
Well, thank you. Thank you very much, Dr. Walker. This regional center and the staff of this center and the leadership of the center and Dr. Walker were a great resource to the Congress of the United States as we went through all of the decisions that had to be made about a national health care plan and how you would implement that and how it would work within the existing systems and the kinds of reforms that were necessary to do that. So I want to thank you so very much for your leadership. He's a leader not just in this county or this state, but all across the country. But as he noted, just 6 months after we signed the legislation, a number of very important patient rights and protections will take effect this September 23rd to put consumers to start to take charge and control of their health insurance, as opposed to the health insurance companies telling them what they can and cannot have, when they need it, when they don't need it. And this is a very big change for America's families as they consider their health security and their financial security going forward. This Thursday, we will now be able to tell families that children up to the age of 26 can stay on their parents' health policy. And it's very important as young people go off to their first jobs. Many of those jobs do not provide health insurance, or if they're going off to school, the school may or may not provide it. They may or may not have enough units to secure it, and that is a great deal of turmoil in those families. Now they know that they can stay on the policy of their parents, and they will have that kind of security. We're joined here today by Gina Rometti, who is here with us today, who is on his parents' policy, and the point is that he will now be able to stay on that policy that his father Frank provides for him through his employment, his payment of, well, it's not actually through his employment, but his securing of health insurance. So that's one less tension that they have as Gino goes to finish his education. I'd also like to tell you about a young woman who couldn't be here because she's taking an exam today, but Lisa from El Sobrante, who wanted to be with us here today, but her father contacted our office just asking a question about what might happen to her daughter. She's graduated of San Francisco State. She's now pursuing a career in nursing. But while she's waiting for her classes, she's not able to obtain full-time status, so she would not have access to health insurance. She will now have access to her family's policy as a result of the new health care law signed by President Barack Obama. We also know that no longer, starting on the 23rd, will health insurance companies be able to retroactively pull insurance away from people at the very moment they need it, when they go to see whether or not they can get reimbursed for health care that they need because of an illness or a disease or a condition that they have. They no longer will be able to pull that health insurance back from them. Annual limits will be phased out over 3 years. Right now, people have an annual limit on their health insurance. If they breach that health insurance, they have no further coverage. Those limits will be raised over the next 3 years, and they will be phased out completely in 2014 when the main part of the legislation goes into effect. Also, starting on Thursday, children will not be denied coverage because of a pre-existing conditions. Those protections will be extended to all Americans of all ages starting in 2014. But children now, many of whom are born with a disease or a condition, so they can't have insurance and they can't be covered on their parents' policy or an employer's policy, and that provision stops. These are basic and fundamental limits. Basic and fundamental rights for these families, for these individuals, as opposed to the limits and the conditions and the arbitrary nature of health insurance as it currently exists. And that was the purpose of passing these laws. Also, we will be getting rid of lifetime limits. This is for individuals who have a lifetime condition where you may be hospitalized on a regular or irregular basis, but often, and pretty soon you bump up against the lifetime limits of your insurance policy, and your insurance policy goes away, and you're left with either not being able to access health insurance or trying to figure out how to pay for it using credit cards, debt, and of course, as we see, almost half of the bankruptcies in this country today are triggered by a medical event that a family cannot handle because of the limits on their policy. Today, Julie Waters is with us, representing her 2-year-old daughter, who was born here at the county hospital. She was fortunate to have health coverage her entire life, but her daughter, Violet, was born 2 years ago with a rare and threatening form of epilepsy due to a sporadic gene mutation. Violet's hospital stays are billed in the hundreds of thousands of dollars, and Violet would likely reach her lifetime limit on health insurance by the time she is 4 years old. As her mother says, unless a cure is found, our daughter will be admitted to the hospital throughout her lifetime, and a lifetime limit on insurance will limit her lifetime here on Earth. That's how serious the changes in these policies that are now invoked by insurance companies on a very arbitrary fashion that they will no longer be allowed to do because of the health insurance law that was passed earlier this year and signed by President Obama. The strange thing is that as we're here celebrating what this means to families, what this means to individuals, what this means to the security and the health status of individuals, we see an effort across the country, and certainly by Republicans in the Congress, suggesting that they can repeal this legislation, that somehow they can just cherry pick one or two things that might be popular and do away with the rest of it. One of the things we learned in writing this legislation is if you're going to have a national system, all of these must be components of that system. You can't just pick out what's popular. You have to do what's right. You have to do what works in this system. And if we're going to maintain this system for families and for children, if we're going to be able to expand the benefits that we're celebrating here today, that's going to be important. I'd like now to introduce my colleague in the Congress, John Garamendi, who won a special election right as we were approaching the vote on health care. He brought not only the enthusiasm for this legislation as he campaigned on for it before it was the law, he also brought a great deal of wealth of knowledge about insurance companies. He'd been battling them as state insurance commissioner for many years in the state of California, and as various arguments were made and outlandish claims were made from time to time, we would turn to John and say, you've got to answer these charges because you have the authority, you have the expertise, and you've been in these battles. And he did it successfully, and again, this legislation was passed. He's going to outline for you some of the additional reforms that go into effect this coming Thursday. John, welcome.
George, thank you very, very much. There are leaders, and then there are other leaders, and then there are exceptional leaders. George Miller, you know, or I know, that this legislation would not become law. The kinds of protections that are here for citizens across this nation would not exist were you not there, and if your experience and knowledge that you gained, part of it right here in this facility, was not brought to bear in Washington, D.C. Yeah, I know insurance. and I know insurance companies, and I know they will take every opportunity to take advantage of their patients, of their customers. They do this routinely. They understand that it's not about the patient, it's about the profit. And they know that if they have to have a very expensive case, like Julie's young child, on their rolls, that they won't have that profit. They know that people who become 23, if they can drop that person, they can continue to get their profit without having to take care of them. Now, this is a personal thing for me. I've got 5 daughters, all 5 of whom have become 23, the most recent just last year. Her insurance company that she had for 23 years of her life, from the very inception of her life, decided that they couldn't cover her under my policy, and they couldn't cover her under a separate private policy because she had a pre-existing condition. She had acne when she was 14. Her real condition was one that more than half of our population faces, and that is she's a woman. To be a woman in America, before the law that George Miller and the Democrats put together in Congress, established you with a pre-existing condition, and your chances of getting medical coverage were slim, and in her case, none. This law is now in effect. She'll go back on my policy on Thursday, the 23rd of September, the 6th month anniversary of the Affordable Health Insurance Reform. Now, and so will you.
Heck yeah. Gino.
We have established the Patient's Bill of Rights in this legislation. The onerous, unfair, discriminatory practices of the insurance industry are over. Their day of discriminating against all Americans is over. If you're 50 years of age and you lose your job, you lose your ability to get health insurance coverage until the 23rd of September, when the Patient's Bill of Rights kicks in and you can stay on insurance. Perhaps you'll have a pre-existing condition and you'll be able to go into the more expensive, the previously expensive program. California will take the insurance law and apply it to the what we call Mr. MIPS here, which is the high-risk policy. Coverages will be available. If you're a young child, as in the case of Julie's child, and you're born with a pre-existing condition, insurance companies previously would deny you coverage. Many cases out there. Not just the expensive cases where Julie has been able to continue coverage for her child, but other cases where they simply wouldn't insure the child at all. And that was a hopeless situation. That kid would probably die without the coverage. Those days are over September 23rd. Every child, regardless of what their condition might be, will be able to get insurance. Isn't it about time that America did that? Isn't it about time that this most wealthy place in all this world would provide the coverages to our children? The Patient's Bill of Rights is fundamental, a fundamental right, access to health care. And the insurance companies, you're going to have to toe the mark. No longer will you be able to discriminate. No longer will you be able to push people off the rolls. I cannot even begin to tell you the number of times when I was insurance commissioner, way back in the early 90s and then once again 2002, 2003 to 2007, where the insurance companies would routinely kick people off because they got sick. They'd find some sort of an excuse, going back over the application, wrong date of illness, any little mistake that was made, not a fraudulent effort, but just a little mistake to get them off the roll because they didn't want to provide that expensive coverage. Here's the message to the insurance industry: that will not happen again in America. Those kinds of rescissions are finished as a result of the law that has been passed, the Patient's Bill of Rights. Now, there's one other problem out there. There's one other problem, and that is that our colleagues on the Republican side, more than 200 of them have pledged to repeal this legislation. They get in power, they have pledged that they will repeal the health care reform laws, giving the insurance company once again license to discriminate, literally license to kill people. And I know people that have died as a result of what the insurance companies failed to do, which is to honor their contract, to provide the coverage. You talk about a death panel, you're talking about the private insurance companies that previously were able to throw people off of their policies when they became sick. Those days are over. On September the 23rd, as a result of the Affordable Health Care Act, those days are over in America. And we're going to go beyond that. And we're going to see to it that in America there is a right to health care, and every American will be covered. It's going to take a little while. There'll soon be an exchange program in years out, 2014, and maybe earlier in California. An exchange program where people can be able to get an insurance policy at an affordable price, and the insurance companies will be forced to compete on price and quality. So for those people out there that want to see this repealed, understand what you're doing to Americans who get sick. For those Republicans out there that have signed that pledge to repeal this policy, you are dead wrong, because there will be dead Americans as a result of the repeal of this law. This is fundamental. The very nature and value of America is what is in this bill. We won't let it happen. If there's going to be a fight, then let us fight on this issue. If there's going to be a political fight in the next 40 days up to the election, then let us fight on the issue of providing health care to every American. Nothing's more fundamental. September 23rd. September 23rd. The Patient's Bill of Rights. It's in effect, and it won't be taken away from Americans. George, thank you for your leadership. Thank goodness you were there all of these months, all of these years, putting this fight forward. And I'm thankful that I was able to be there on the day this passed the House. Each of us having an opportunity to advance the care of Americans. This is going to be a good day. Thank you.